Hi, my name is Lauren. I do have another video already, so if you haven't checked it out, it is about my experiences with epilepsy. This video is on my decision to try the VNS surgery for my epilepsy. I had gone 5 months, that's the longest time I've been without a seizure for the past couple years, and I went 5 months without one and then went into status again. So they changed my meds and had me titrate, and that still hasn't been helping. I've been having about a seizure a week since for about a month and a half now. So in May of 2014, my epileptologist said that if I had any more seizures that we would look into surgery because the medications haven't been helping. So he gave me the choice between brain surgery and VNS surgery. I was totally against surgery at all at first, and so were my parents. Just everyone was, no, try and go with the meds, and so it was definitely a hard decision for me to make. But talking to the epileptologist after the most recent ICU adventure with status, I've decided that the VNS would be a good option for me to try. For the pros and cons, with brain surgery, if they can take out the part of your brain that's where the seizures are starting, you can potentially stop the seizures for good. However, my seizures they start close to the speech area in my brain, and getting that part of my brain taken out could severely affect my speech, as well as my motor skills, and also my personality. So that's definitely a scary thing. With VNS, there's no guarantee that it will work, but there is that chance that it will, and they say 1/3 of patients benefit greatly from the VNS surgery, 1/3 of patients have a little benefit, and 1/3 of patients don't see a benefit. So if I could be in, one of those percents that benefit, that would be awesome, because going through nursing school with grand mal seizures is not really the best for me or for potential patients that I may take care of. And when making the decision for VNS surgery, I did a lot of research. I watched the little video they gave me, read the brochure. I looked up every kind of YouTube video with people talking about VNS, what it is, how it works, the side effects, how people liked it, if it helped them at all, which is partly why I'm doing this video, to hopefully give someone another perspective on it, because there's not that much information, not that many videos out there about VNS. So I did that research. I also looked up some journals about it. Being in nursing school, I have access to some journals, medical journals, nursing type journals. So I did that. I talked to a few doctors about it. I talked to some of my nursing professors at school about it. It's not very well known. A lot of people don't really know about it, even in the medical community, which was a little disconcerting, just because there's these professionals that don't even understand how it works. So that was a little bit of a something that made me a little nervous. But something else that I did was I asked my the nurse practitioner at my epileptologist's office if they had any patients who had the surgery who would be willing to talk with me about it. So she found a patient with a similar case as mine, and I was able to speak with her and get her opinion on the VNS surgery and if she thinks it helps, if she's glad she did it, those kind of things, which I think is really what pushed me over to making the decision to get the VNS. So I am definitely nervous about it. It is Monday, and I will be getting the surgery on Wednesday. So, you know, I'm definitely nervous about it. Maybe not so nervous about the surgery itself, but more hoping that it will help me as I go into my second semester of junior year of nursing school. I am a little bit upset about the side effect of maybe not being able to sing. I do love to sing. I play the ukulele and I enjoy singing. I'm not the best singer, but I do enjoy it. So I'm hoping that it doesn't severely affect my singing. And just that the benefit outweighs the side effects from it, or the potential side effects from it. But I've decided that this is the best thing for me to do, and my epileptologist and the nurse practitioner agree with me, and you know, everyone's on board. I've met with the neurosurgeon for the consult. The consult pretty much consisted of me going in and getting a folder with packets in it, just talking about the surgery, talking about what to expect. I had never had surgery before, so I didn't know what to do at a consult. But it's pretty much just asking questions. The neurosurgeon that I talked to was really, really nice, and he was saying that all his patients who come in for this surgery, if they're under 30, they pretty much know more than he does because of the information that's out there on the internet and everyone who's doing research about it. So, you know, it's nice to know that it's not that challenging of a surgery. He said it'll take about 45 minutes. I've seen anywhere from an hour to 4 hours in brochures and information I've seen. It's supposed to be an outpatient procedure, which is nice. They decided they want to keep me overnight due to my history, and instead of waiting the usual 2 weeks, I hear is the norm for when they turn on the device. They want to implant mine on a Wednesday and turn it on Thursday, just to get it started. So that's a little nerve-wracking, but hopefully the healing process and getting it turned on at the same time will be okay for me. So, I mean, the major risk is really just the infection from surgery, but the neurosurgeon was saying that since I'm a nursing student, I know how to care for a wound, that I should be fine, so I shouldn't really have to worry about that as much. But I plan to make some more videos. Hopefully they're helpful. If anyone wants to ask me more about my decision or my specific case, I am very open about talking about all of that to help other people, definitely. So just leave any comments if you have questions, if you want to know more about VNS, if I can help you, if I can help you find a resource. I would love to do that. So just leave a comment, and I hope this video helped you out a little bit.